Have you struggled to get or provide critical veterinary service to your pet or homeless pets under your care? 99% of everyone I talk to these days says yes. And in today's Saving America's Pets, we are going to explore how to get creative and save lives even during this time of veterinary resource shortages. Hi, I'm Holly Sizemore, Chief Mission Officer for Best Friends Animal Society, and this is Rose, my cuddly co-host. Even pet owners who can pay full price are complaining about veterinary service shortages, so you can only imagine what nonprofits and shelters are going through, who often depend upon charitable contributions of veterinary services. But we can't let scarcity rule us. And in today's episode, I'm so happy to have Dr. Erin Katribe, Medical Director for Best Friends Animal Society, to help us understand how we can persevere now and into the future as we grapple with this issue. Welcome, Dr. Erin. Thank you so much for being here.
Hi, Holly. Excited to be here.
Tell us, why is there a veterinary shortage?
Well, first, let's quantify it. I just want our audience to know how significant this problem is. The AVMA, the American Veterinary Medical Association, found that there were 18 positions open for every vet seeking a job, as well as 6 for every technician. So this problem is significant. And the answer to your question, why, in my opinion, we're simply not graduating enough veterinarians. And so this is a problem that's been coming down the pike for a bit. And there's just so much need. There are more pets in homes than ever, and there are more shelter pets that need veterinary care than ever.
How specifically has the shortage affected shelters then specifically?
Yeah, the impact on shelters has been similar to that across the industry. It's that there are so many open positions. I know of shelters that have had unfilled veterinary positions for months or even years. There are shelters that take in thousands of animals that don't have a veterinarian even on staff and are having to rely on other sources of veterinary care. So it's definitely affecting shelters.
That sounds pretty daunting. So what's being done to solve for this, both long and short term?
There are definitely some things in the works to try to solve these issues. There are more universities that are opening up veterinary colleges, trying to solve for some of this gap. There are university programs that are looking at what is being called a mid-level practitioner. So you can think of it like a physician's assistant, but for the veterinary field. And even more in the immediate, in the short term, that I think will be really useful is really expanding how we use support staff in shelters. So if there aren't enough veterinarians, how can we do more with the vets that we do have and the support staff that we do have? And so I think there's lots of technicians out there in the world that aren't being utilized to their full potential that shelters can and veterinary clinics can capitalize on.
Give us an example.
A great example of a strategy to utilize your support staff better that I think shelters are actually uniquely positioned to really capitalize on in a way that private practices may not be able to. It's leveraging that support staff with veterinary oversight to implement things like protocols that we can use in the shelter for our most common conditions. If a veterinarian signs off on that protocol, in a lot of jurisdictions and a lot of states, it's totally reasonable for that medical staff member or that veterinary technician to implement treatments for that very basic condition. And you don't even need a vet oftentimes on site, or maybe not even on staff at all. It just needs to be a vet of record that signs off on that. And so that's a great example of a strategy shelters can use to leverage their support staff when their veterinary bandwidth is very limited.
You've done a lot of work directly with shelters. Can you give us an example of some protocol that you've put into place that has done what you just described?
Sure. Well, let's take one of our most common shelter conditions. So feline upper respiratory infections. As a veterinarian, I created a protocol that outlines what the common symptoms of that disease are and walks a technician or a medical staff member through the steps to take if they observe those clinical signs of disease. It may mean starting a medication. It may mean simply monitoring. It may mean moving an animal to isolation. But the technicians for those most basic straightforward cases can implement that without getting a vet involved, and they can start those medications and move that animal as is appropriate for that case.
We hear a lot in the sheltering industry about capacity for care, and that bottlenecks are a big part of this, and how we can work through to declog those bottlenecks. We know that spaying and neutering shelter pets before adoption has been a big bottleneck this summer. Give me your opinion on that and how we can cut through that bottleneck.
You're exactly right. That is, even before the pandemic, that was a bottleneck for a lot of shelters. I have a couple of thoughts. The first one, and this applies to all medical operations in a shelter, it's to really critically evaluate your efficiency. Surgery is a great example. And if it's looking at your technician scheduling and looking at your doctor scheduling, what if we reduce the number of days of the week that we're doing surgery, but we really stack our support staff? So we have more of them on the days we are doing surgery to support that vet, and we end up getting more surgeries done in fewer days. And so that's an example of, if you only have a vet a certain number of days a week, we can get the same amount of more done with that single veterinarian. The other strategy I'll mention, and I think that this is really an untapped resource for so many shelters, it's reaching out to the private practices in your community. We need to develop private practice partnerships, and spay neuter is a really great place to start developing those partnerships. If you have a vet on staff, but they're overwhelmed already with the caseload for shelter sickness, can we outsource some of those straightforward spay neuter surgeries to a private practice vet in the community?
Knowing that even in private practice, there seems to be a demand for services that is hard to meet, what's in it for private veterinarians to go along with some of these partnerships?
So that is definitely a great point. Even private practice veterinarians they're seeing more appointments now than ever before, and they are also suffering the effects of this shortage. But what I would say is, we can make this mutually beneficial for both the shelter and the private practice. In a lot of cases, if we streamline our communication and we make it as easy as possible for that private practice vet, sometimes seeing shelter animals is a lot more efficient for them than seeing those owned pets. And so really both sides can benefit, because they can also capitalize on that increased efficiency.
Is there anything else that you'd like to add?
I think the final strategy that I would mention is that shelters can employ is really focusing on not just recruiting, but also retaining the veterinary staff that they have. And it's not just limited to veterinarians. That also means our support staff, our veterinary technicians as well. So really reducing turnover for veterinarians and technicians as much as possible. If we invest in our veterinarians and in our veterinary staff, we keep them engaged and we give them a good work-life balance, that it's going to pay off in the long run.
You're absolutely right. Giving that work-life balance is so important, because these jobs are emotionally and physically very demanding. When veterinarians and vet techs are on site, how can we better support them in the daily work with some of the hardships of the job?
Great question. When we think about things like work-life balance and about stress at work, we can do things, offer tangible benefits, things like mental health support and that sort of thing outside of the job. But at the end of the day, I think the most important thing is for leadership to provide that support with the workplace culture. It's making those veterinarians and technicians feel supported, that they can set boundaries on things like workload, and helping to support them do the work that they're doing, but also support themselves.
Thank you so much, Dr. Erin, for taking the time to be here with us today, because I know you're very busy. We really appreciate it. Great advice.
Thank you, Holly.
Until we can get more veterinary resources, we can pivot on certain things. We don't want to burn out the staff we already have. And in order not to do that, we need to think differently about how we provide some of the services. Ideally, we want every animal spayed and neutered prior to adoption. But with today's technology, like automatic text appointment reminders, letting pets be adopted prior to spay neuter just makes sense when veterinary bottlenecks can create more serious risks for our shelter animals, like disease and overcrowding. Being able to pivot to meet the moment will help us to save them all.